Good morning, everybody. So James and I are going to take you on a tour of the last couple of years of quality improvement at East London Foundation Trust and give you a synopsis of what we've been doing and the impact it's been having so far. And to frame that conversation, we're going to be using our driver diagram, our theory of change about how we want to achieve our goal of providing the highest quality mental health and community care in England. So the 4 orange boxes, being our 4 primary drivers, are the way in which we're going to talk through for the next 10 minutes. And we're going to start off with the top one, which is building the will.
Thank you, Amar. Good morning, everybody. Thank you. So we continue to build the will in a variety of ways at multiple levels within the organisation. Starting off, we have a team go and present to the Trust Board every time they sit, talking about a QI project they've been working on. We continue to use our electronic and paper newsletters. So we send out our electronic newsletter to 5,000 staff every month and to around about 500 external partners as well. And we send out a paper newsletter on a quarterly basis to over 550 sites externally. Has anybody seen the visibility wall at Trust Headquarters? Show of hands? Yeah, so that's on the ground floor. It really is quite big, isn't it? About 10, 15 metres wide. And it really allows us to tell the story of QI. It contains many permanent and semi-permanent elements. And it's been great to see, as more and more projects start to see results, people starting to publish their work. So that's 12 projects now published or submitted for publication in the BMJ, and that will continue to build. And then let's not forget our QI microsites. This is our one-stop shop for everything to do with QI. It's available both internally and externally. And we had a very special week last week because we reached 100,000 views, which has been really, really quite fantastic. And let's have a look at where those views come from. So this is a heat map for 2015. So the red over the UK is pretty obvious. We've seen a lot of views from the UK. We've also seen views from 52 countries across the world. It's really quite impressive. And the visits to the Trust have not just been virtual through the microsite. We've seen a lot of people come to visit you to see the great work that you're all doing. You've got lots of pictures there, but we had an experience day back in April last year. We had 70 international delegates coming just to see what you're doing. And we regularly have open days for people to come along. And we're starting to influence thinking and policy on the national stage now. So we're included as a case study in the Health Foundation Building Foundations for Improvements. Last month, we were featured in the Old Problems, New Solutions sort of paper for the Royal College of Psychiatrists. Again, last month, we were featured by the King's Fund in their Improving Quality in English and NHS. And finally, you just heard from Jim Mackey, the Chief Exec of NHS Improving Quality, but at their sort of launch event last month, we featured very heavily and were also mentioned by Don Berwick, who is the former Chief Exec of the IHI. So let's hear a couple more messages of support from some of our national leaders.
Jennifer Dixon here from the Health Foundation. I just wanted to send you a note to you and your colleagues to wish you all the well in your conference and to say I think you're a shining example of how quality improvement can be developed in a trust. You've really made great strides and you're one of the few trusts in the country that have done so. And most importantly, you've rooted this at the clinical front line, which is where it all really matters so much. Anyway, well done, enjoy the conference, and let's work on something together soon.
It was really impressive to see the very systematic way in which people were working to improve quality, and seeing something of the immediate benefit this produces, not only to patients, which of course must be our first concern, but actually to other staff within the organisation. And I know that this is a trust-wide initiative, so I do congratulate you on what you're doing, and I hope that you're going to continue leading the way for other people in the NHS about how to provide high-quality services for your patients. Thank you very much.
And it goes on from there as well. So because of the great work that you guys are doing, we're being nominated and shortlisted for more and more national awards, 12 since the programme began. And that's translated into 5 wins 5 wins for very, very prestigious awards. And let's finish off looking at the NHS staff survey. So we showed you this last year, and we showed you the impact in 2014 that the QI programme had across staff feeling able to contribute towards improvements at work, motivation at work, job satisfaction, overall engagement score. So we still remain in the top percentage of mental health trusts, top 5 in fact. And you can see a very slight dip in some of our scores. We think that may well be due to Luton and Bedfordshire coming and joining us. But you've got to remember that Luton and Bedfordshire are starting their QI programme today. So Luton and Beds are watching this as we go along. And I'd just like to say it's great to have you on board. Absolutely fantastic. And we're so happy that you're starting your launch event today. And we're really hoping you're going to have great fun as you do QI in the next few months. Amar.
So the second of our big areas of work is on building improvement capability at all levels of the organisation. And some of you will have seen this before. It's our capability model, our plan for building skills at different levels of our organisation. So we have a good sense of what skills we need and what numbers of people need to be trained at different levels of our organisation. The Improvement Science in Action has been one of these offerings and the main vehicle really in the first 2 years for building skills. This involves learning in a variety of formats, both face-to-face, through coaching, through online learning, online modules, around a real-life problem, a real project you're running in your team together. We've had 4 waves of people who have graduated through or are nearing completion in the Improvement Science in Action, and in total that's 480 people in 2 years who've now gone through that level of learning. Of course, that level of learning isn't necessary for everybody, and so in the last 6 months we've also started offering a much shorter classroom-based modular offering called Pocket QI, where people can dip in and out as they have the time to learn a little bit about QI. So if you're involved in a project or you just want to find out more, there's now something you can do quickly and easily to learn key skills. And in the last 6 months, we've had 134 people now complete the Pocket QI offering. One of the key elements for our capability building is over the last year, we've recruited a cohort of coaches. So the first cohort of 29 coaches have now finished their training in the last year. And they have deep skills in improvement, as well as skills in coaching teams. And they are the first line of support for projects at the front line. And we think this is a really key element of our support structure. We're also trying to provide service users and carers with the skills they need to be involved in quality improvement. And over the last year, 40 of our service users and carers have gone through the introductory offering that we provide. So how are we doing after 2 years against our initial plans? So for all staff, we're about 75% of where we think we ought to be at 2 years. And if you look at sort of what percentage of people have been trained at different bands within the trust, you can see the blue bars there representing the Improvement Science in Action, which is weighted heavily towards those in management positions and leadership roles, which is what it's meant to be. The red bars there, being Pocket QI, is going to be the way that many people, busy frontline clinicians, find ways to learn about QI and use that in their day-to-day work. So over the next year, we're expecting to see the red bars creep up amongst many of these areas of our workforce. With our coaches, we're where we want to be after a year with a group of 30, and we're about to recruit the second cohort of that starting soon. With our internal experts, who are absolutely key to this work, we're sort of a little bit below capacity, but we're going to address that in the next few months. And our board is really important as well in leading this work. So most of our executives have completed the Improvement Science in Action, and the whole board has had regular learning sessions around quality improvement and how to apply that at board level. So you've heard some numbers. Let's hear a little bit from people who've been involved in training, different types of training over the last year, about their experiences.
Data, because we keep revisiting that. So I think now I can actually help my teams sort of determine whether the changes they've made have actually delivered an improvement.
The opportunity to share with the other coaches has been really important. So even in today's session and then previous sessions where we've been able to do scenarios and learn from each other, really helpful, and that kind of group cohesion has been a valuable part of the process.
Very supportive process, yeah. I think it'd be good for other people to join the coaching network and join in.
QI is a chance to become creative.
We kind of galvanise the team and team members to actively participate in change.
The training's been really fun. I like how it's been very relaxed dance. And I like as well how inventive the coaches and the leaders are.
I think it's been really useful. I think the fact that it's so hands-on, the fact that we're able to apply the training to our own projects, sort of moves it from theory and into something which is practical.
I enjoyed the fact that the training was really interactive. AI is an excellent idea to come together to make change that happens from the grassroots up.
I know I will take these skills forward, especially into what I'm interested in, which is physical health and violence reduction.
Okay, great. So we've built some will, we've built some skills, but without making this truly business as usual for the organisation, it'll be very difficult for QI work to happen. And that's why we have and we continue to try and build stronger and stronger support structures around our QI projects. So in the centre here we have a QI project. This is actually the Bevan Ward team. And around them we have a project sponsor. So that's a senior person who's able to break down barriers and able to champion the cause. We have a QI coach, Amar just mentioned, somebody with 1 day a week ring-fenced time to support those projects. We have the QI team, we have QI forums where people can get together and talk about what's going on and share and learn. And then we also have service user input, absolutely important. And when we think about service user input, we're thinking in terms of two levels, involvement with the little I and involvement with the big I. So involvement with the little I is when we're regularly consulting service users throughout the lifetime of the project. That may be surveys, it may be focus groups, it may even be forums. Whereas big I is a service user being an equal part of the project team whenever they meet. And finally, we've worked really hard to sort of build resources, electronic resources around all projects. If you double click on your desktop for any member of staff, you can now see and search for QI work in the rest of the trust, which I think is really important as the programme builds, so we don't reinvent the wheel. We can see what other people have done on the topic that we're trying to work on. And we've also worked hard to make sure there are dashboards available for you now, so you can see data over time at directorate, at trust, and even at team level, and rather than having to constantly figure out how to measure new stuff. Amar.
So what impact has all of that had on projects? At the moment, there are 155 across the whole trust, and you can see how they fit into our two big strategic aims of reducing harm and right care, right place, right time. Many of those projects also focus on similar themes. So the 4 priority areas for us this year are violence reduction, pressure ulcers, physical health, and access to services. And you can see the number of projects working on those areas. It just shows you the trajectory of projects over time, that this is building and building consistently over time. And we're able to track the progress of each project. Each project goes through natural stages of evolution, and we can track that month on month and see how that's developing over time. But the big question is, what impact is all of this having?
So let's have a look at one of our high priority areas, violence reduction. And we continue to see a 25% reduction in violence across the entire trust, which I think is just so impressive. And if you look at benchmarking data below, you can see how it's switched in 3 years from above average to very, quite a bit below average, which is really, really impressive stuff. And underneath of that, some really great stories. So the Tower Hamlets Violence Collaborative, working across an entire system now, across 6 wards, seeing a 57% reduction, in fact, across acute adult mental health wards, testing a variety of things. This is one I love, Cedar Ward, in mental health care of older people, looking at reducing the amount of noise on wards, because they know that has a strong link with violence, using a thing called a Yakka tracker. Has anybody heard of one of those before? And they're showing a 14% reduction in sound. Remember, that's a decibel rating, so that actually is a logarithmic scale, isn't it? And finally, Clerkenwell wards and forensics, now showing a 48% reduction in violence by testing a variety of things, including a sensory room. Let's look at pressure ulcers. So hard work in pressure ulcers, but seeing great improvements and great work going on. A 61% increase in Waterloo bundle compliance, 29% decrease in grade 2 pressure ulcers, and really pushing the boundaries now, testing lots of new things, lots of new ideas coming through. How about access to services? So important for all of our service users. Across a group of 15 teams working to reduce this, we're seeing a 16% reduction in waiting times across those teams, a 19% increase in the number of referrals, with a 22% decrease in DNAs, which I think is absolutely fantastic. And once again, some great stories in there. So we've got the MSK team in CHN and the psychological services team in Newham, both testing texting to service users prior to their appointments, and they're both showing 41% and 80% reductions in DNAs based on that. We've also got the Newham CFCS team in Children's Directorate showing a 19% reduction in waiting times by testing telephone triage. Amazing stuff going on. And finally, you're going to be hearing a lot about physical health today. There's a lot of work, both from a technical side with inline monitoring forms, as well as QI work to tackle this massively important area.
So